The hidden dangers of daily bathing for people over 65. Bathing every day may seem like a healthy habit, but for individuals aged 65 and above, it can pose serious health risks. Especially when using hot water, the aging body may react poorly due to the gradual weakening of the autonomic nervous system, which regulates blood pressure and body temperature. When elderly individuals enter a hot bath, the high temperature causes blood vessels to dilate rapidly. This can result in a sudden drop in blood pressure, leading to dizziness, fainting, or even stroke. In many cases, seniors may fall in the bathroom, a place with slippery floors, and often no one nearby to help immediately. Clinical studies show that when people over 65 soak in water above 41 degrees Celsius (105.8 degrees Fahrenheit) for more than 15 minutes, the cardiovascular system is stressed by 20% to 30%, similar to light jogging but in a far more hazardous and slippery environment. To ensure bathing remains safe and beneficial for older adults, doctors recommend several simple yet crucial measures. Lower the water temperature to between 38 degrees Celsius and 40 degrees Celsius, 100.4 to 104 degrees Fahrenheit. Use your wrist or the back of your hand to test the water before entering. Limit bath time to no more than 10 minutes. Drink a glass of water before and after bathing to prevent dehydration, a common cause of sudden blood pressure drops. Sit while bathing. Use a specialized shower chair to reduce the risk of falling. For those over 80, avoid bathing alone. Inform a family member or install an emergency alert device in the bathroom. Just a few small changes in daily habits can help seniors avoid unexpected and dangerous accidents. Daily bathing can damage elderly skin. As we age, the skin loses its natural moisture and oils. Over time, the sebaceous glands become less active and the skin turns thinner, drier, more fragile, and more prone to irritation. Daily bathing, especially with hot water and regular soap, strips away the protective oil barrier. This impairs the skin's ability to retain moisture and makes it more vulnerable, sometimes even leading to infections. Many older adults complain of itchy, flaky, red, or cracked skin without realizing that frequent bathing may be the root cause. In more severe cases, the skin may become inflamed or infected, as bacteria can enter through microscopic cracks in the surface. To maintain healthy skin in later years, doctors advise the following. Bathe only 2 to 3 times per week, which is sufficient to maintain personal hygiene. You don't need to use soap over the entire body every time. Only use soap in areas prone to sweat and bacteria buildup, such as the armpits, groin, and feet. Other areas, like the arms, legs, and back, can be cleaned gently with warm water or a soft cloth. Choose mild, skin-friendly soaps with a pH between 5.5 and 6.0, close to the skin's natural pH. Avoid strong detergents or heavily fragranced soaps, as they tend to dry out the skin. Within 3 minutes after bathing, apply a moisturizer to lock in hydration. Look for creams containing ceramides to repair the skin's protective barrier and hyaluronic acid to retain moisture and keep skin soft and smooth. Proper skincare not only helps older adults feel more comfortable but also reduces the risk of infection, inflammation, and keeps the skin resilient over time. Bathing can lead to falls, a major risk for seniors. The bathroom may seem like a safe place, but it's often a danger zone for elderly individuals. Falls in the bathroom are one of the leading causes of serious injuries among older adults, especially during colder seasons or when physical strength declines with age. A seemingly minor slip can lead to a hip fracture, a common yet extremely dangerous injury in seniors. Statistics show that around 25% of people over 80 who suffer a hip fracture die within a year due to complications such as immobility, pneumonia, infections, or general health decline. Even survivors may lose their independence and require assistance or relocation to a care facility. Bathroom falls often occur due to 3 main reasons: slippery floors from water and soap, sudden drops in blood pressure after hot baths, leading to dizziness, age-related muscle weakness, slower reflexes, and balance issues. However, falls can be prevented with a few practical and effective changes. Use non-slip mats both inside the tub and on the bathroom floor. Install sturdy grab bars in key areas like near the bathtub, shower, and beside the toilet for support when sitting or standing. Use a shower chair to reduce the risk of slipping, especially for those with limited strength. After bathing, don't stand up too quickly. Give your body time to adjust to avoid dizziness. If you're over 80 or have a history of low blood pressure or heart conditions, don't bathe alone. Let someone know, or install an emergency button in the bathroom. With just a few small adjustments, you can keep yourself or your loved ones safe while bathing and avoid unfortunate, life-altering accidents. Adjusting body temperature after bathing, a vital step for seniors. As we age, the body's ability to regulate temperature decreases. This makes older adults more susceptible to sudden chills after bathing, especially in cool or cold weather. If the body isn't dried properly or kept warm promptly, hypothermia can occur, a dangerous condition that's often underestimated. Some seniors, after bathing, may sit in a cool room with wet hair or light clothing. Within minutes, they may feel cold, fatigued, lightheaded, or develop a sore throat. In severe cases, body temperature may drop to unsafe levels, requiring emergency hospitalization. To prevent this, doctors recommend simple but highly effective steps. Warm the bathroom before use. You can use a heater or close the door to trap warmth. Transitioning from a warm bedroom to a cold bathroom can cause a sudden shift in body temperature, stressing the heart and blood pressure. After bathing, dry the entire body immediately with a soft towel, preferably one that's been warmed. Be sure to dry your hair, as wet hair can lead to heat loss from the scalp. Put on warm clothing right after the bath, even on mild days. A long-sleeved robe, pants, and socks help stabilize body temperature. Drink a warm glass of water or hot tea post-bath. It helps warm the body from within, boosts circulation, and promotes comfort. The best time for bathing is in the afternoon, between 2 to 4 p.m., when the day's temperature is at its peak. Avoid early mornings or late nights when it's cooler, and the body is less adaptable. Keeping warm after bathing isn't just about comfort. It's about safeguarding the health and well-being of older adults each and every day. Overcleaning may weaken the skin's natural immune defense. It may sound strange, but bathing too frequently, and especially using antibacterial soap, can actually harm the skin and weaken the body's immune defenses, particularly in seniors. Our skin is not just a protective shell. It also hosts millions of beneficial microorganisms, known as the skin microbiome. These good bacteria act as a natural shield, preventing harmful bacteria from invading, supporting skin health, and bolstering the body's immune system. However, frequent washing with soap, especially antibacterial types, wipes away both good and bad bacteria, disrupting the skin's natural balance. In younger people, the microbiome can recover quickly. But in older adults, this process takes longer, leading to drier, more cracked, and infection-prone skin. Some seniors who maintain a daily bathing routine with strong soaps often experience persistent itching, rashes, dermatitis, or minor skin infections. These symptoms are often misattributed to allergies or aging when, in reality, they stem from overcleaning. To protect the skin's natural immune system, experts suggest use soap only 2 to 3 times per week and limit it to key areas like armpits, groin, and feet. Avoid antibacterial soaps. They are unnecessary for daily hygiene and can harm beneficial microbes. Maintain indoor humidity at 40 to 60% using a humidifier, especially in winter or when using air conditioning. Proper humidity prevents dry skin and preserves the skin's protective barrier. Keeping skin clean is important, but keeping it healthy and resilient is even more vital, especially in the later stages of life. Bathing is for cleanliness, but done wrong, it can become a health hazard. At an older age, even the simplest daily habits, like bathing, need thoughtful consideration. If done incorrectly, bathing can go from a hygiene routine to a threat to health, or even life. With just a few mindful changes, seniors can stay clean, comfortable, and, most importantly, safe, protecting their heart, their skin, and their overall well-being. Bathing less doesn't mean being less clean. It means bathing smartly, scientifically, and in a way that promotes a longer, healthier, and safer life.